Education, Part 2. This is a follow-up of the webinar we had in October. My name is Erika Calderon. I work for the Inter-American Institute for Cooperation on Agriculture, ICA, and I will be moderating the session today. We will really not formally open the meeting because this is just a continuation. This is a series of 3 different webinars we will hold. The third one will be sometime next year in February. We are planning for you a series of webinars throughout 2023. So we have much more training materials to help us prepare for the animal swine fever in Latin America and the Caribbean, or in the Americas and the Caribbean. This is an initiative that we have had within the framework of GIFTASK, where ICA coordinates the interagency group that meets weekly to work on all these webinars. The group consists of several agencies, both international as well as regional and sub-regional, as CARIVET, CAFSA, AMSA, FAO, WH, OIRSA, USDA, COPEX, ICA, and IFIS, and others. We are all making a big effort to focus all these training courses down one line so that we can reach as much of the audience as possible. All these webinars are being also broadcast through social media. So you can share this. This is on social media, both Facebook as well as YouTube on the ICA's sites, and you can share these with all the people you believe this would be appropriate for and who have an important role and must know about preparation in preparing for African swine fever. We have an excellent group of speakers today. At the previous webinar, we had a general foundation of risk communication, how to address it. Today, we will hear practical experiences in preparing for a risk and what CVP has been done. We will hear the experience of the Caribbean region through Carla George, as well as preparing for risk communication in animal health from Shiloh Webb from the United States. So without further ado, let us go into the first presentation. Please do not hesitate in posing your questions through the chat, either the conventional chat or the question and answer portion. At the end of this session, there will be a session for questions. So please remember to select your language for the interpretation purpose. And let us know where you are joining us from, your institutions, your countries. So let us begin our first presentation. This will be Gabriela Campon from CBP, from the Permanent Veterinary Committee for the Southern Cone. Gabriela is an agronomist engineer from UDELAR, Uruguay, and a master in science in sanitary program in food safety management from the University of International Cooperation in Costa Rica. She has a master's she has a master's, between 2009 through 2012, she headed a series of executive leadership in food safety from ICA, University of Minnesota, and University of Nebraska. She has been a rural producer for 10 years. She has been communicator in different radio and television media in Uruguay. She has 20 years of working experience. She was part of the technical secretariat of the CAS, the Southern Agricultural Council. She currently works at the technical secretariat of CVP, composed by Argentina, Bolivia, Brazil, Chile, Paraguay, and Uruguay, currently based in Uruguay, and she participates in the technical secretariat of the Animal Health Commission, holding frequent meetings with the regional private sector. She has participated in several activities, including up to the highest decision-making leaders. She has more than 20 years of experience in national and regional and international meetings. Dr. Campo is unable to join us today, because she has another commitment. So any questions you may have, please pose those anyway, because we will pass these on to Gabriela for her response. So without further ado, let us listen to Dr. Campon's presentation.
Bueno, ahora sí, muchísimas gracias.
Now we go. Thank you very much, Erica, for your introduction. First of all, my apologies, because the fourth meeting of the CVP is going on in Paraguay right now, so I apologize, I cannot join you for long. But anyway, I will talk about the regional risk communication strategy. Currently, Argentina is holding the chair. Dr. Jimena Melón is the chair of this meeting. For those of you that do not know the CVP, it really depends. It depends on the ministers of agriculture in six different countries: Argentina, Bolivia, Brazil, Chile, Paraguay, Uruguay, and the veterinary service of those countries. There's a pro tempore chair, a technical secretariat, which rotates every year. There are 2 offices permanently from the beginning. Next year, we will be celebrating our 20th anniversary at the committee. The committee has 2 commissions: the Animal Health Commission, which consists of the different delegates from the region, and the lawyers session, which is so important for these activities. 9 ad hoc working groups participated this year, very intense Zoom meetings and in person. The committee has a strategic plan 2021 through 2025, and as you can see, it consists of 2 cross-cutting strategic pillars that are knowledge management and communication. And under that umbrella of communication, we have risk communication. How does the strategy for risk communication arise? In 2019, there was a workshop between the public and private sectors, so that the guidelines we show respond to the workshop held together with the private sector, something fundamental. Going over, CVP has 5 regional strategies: foot and mouth, avian influenza, salmonella, AFS, and the common African swine fever. Well, there's a framework of communication here. There are different regional organizations like FAO and World Health Organization that are using to develop a risk analysis to face and have the ability to address sanitary and food safety issues. It allows to a diagnosis of problems and to find more specific and more efficient solutions. Risk analysis is the tool used. This is an overview I have to give any time anyway to understand the strategy, but all of this through different seminars. This is, I would just take a few minutes to explain this. Risk analysis, I was saying, is the tool that the governments can use to manage, assess, and communicate risks in transparent and objective decision making for sanitary measures and food safety. The World Trade Organization, through its SMS agreement, promotes this tool to have a focus on scientific principles for animal health, human health, One Health, not only, but also covering international trade. Here, there are two perspectives of Codex and WAH. We see that risk communication is permanent. It has a risk assessment component based on science and a risk management a component based on policies and policies, basically. This is an overview. We covered part of this at the previous seminar: who, what, where, when, why, the 5 W's. There's an interactive exchange of information throughout all the risk analysis process. We have a whole chain here of authorities. The state has a fundamental role in all of this. We work with all the different factors of risks and hazards and perception of risk among risk managers, risk evaluators, consumers, industry, and throughout the entire food chain. How can we determine these communication strategies? For this, we need to know that this is directly related to the nature and magnitude of the hazard. The public that perceives the risk may experience, depending on their perception, their different levels of outrage, indignation, and that really depends on how the communicators convey the hazard or the risk of a given sanitary event. The purpose then of this is to close the gap between the way the experts define risk and the way in which the public perceives this. So we see that risk will depend on the hazard. Here is a graph. This is somewhat old, but I like it anyway because it is very clear, very visual, and clearly shows how a good risk communicator that has to be part of the communication team can really handle perception and change the risk perception based on how everything evolves. We have indignation, outrage is very low, so that is a perfect time to educate in health. For example, CBP is organizing a meeting in December where the swine experts will be attending to prevent the entry of African swine fever. They will be meeting with a group of communicators at CVP, and the private sector will also be present at times. The swine raisers. The objective is to harmonize the risk communication strategy. So there is a target audience in all of this. At this time, we are there. The danger is imminent. You must wonder how the different parts of the chain feel that emotional reaction. Do they really have the notion that there is a risk? And based on that, then we evolve. So we have the managing indignation, basically depending on the situation. We have preventive awareness, communication of crisis, all the different elements in this. A risk communication program, well, any institutional structure needs to have one. It has a complex and dynamic structure and obviously needs a health and safety policy to frame this policy. This policy exists in all countries. We need to try to write communication, risk communication strategies in a clear manner. Obviously, it requires teamwork, and it should be part of a risk analysis team or unit. This must be very clear. The risk communication team must fit within an institutional structure that covers a lot of disciplines, a lot of institutions. It has to be interdisciplinary and interinstitutional, that is. It operates from a regulatory framework, and therefore it is the undeniable responsibility of the state. It is focused on compliance with sanitary and phytosanitary measures. It has competency both international as well as national matters. It is a next link between the private and public sector, and it is part of an interinstitutional framework and can coordinate, and it has a broad scope in all the institutions we will see later. There is much in writing, but I promise I will show you a table, a very brief table in a moment. The objective is of CVP to prevent African swine fever is to strengthen and maintain a risk communication harmonized, as we said before, between public and private sector, focusing on the agri-food chain at the regional and country level. Where do we start from? From that workshop in 2019, when we developed the regional strategy for risk communication. And when we talk about harmonizing, it is not that each country just copies and pastes the strategy. No, if the country does not have a strategy, well, they could adopt it and adapt it. And the rest that are already working on this and that do have a strategy, evidently they must adapt also to adapt as much as they can according to the reality of each country. So definitely we will be talking with common language, which is so important at the type of harmonizing any strategy, be it sanitary, food safety, and risk communication in any case. Okay, this is the one I wanted to show you. These are the guidelines for the risk communication strategy. It expires this year, notice, but it is still active. We will have to update the strategy to see if from 2019 to date, the countries did find this document useful. We have had several workshops with FAO and IICA, and yes, we have found that it was very useful, but here you can see the different points contained in these guidelines. We will give you a few examples of prevention and preparation, and then a bit about the seventh phase, which is beginning and ending. The objective of a risk communication strategy, is to maintain streamlined, continuous communication with all the stakeholders, focusing on the agri-food chain, including all institutions involved, and permanently offer, because we do not need to have an outbreak of any disease to trigger the risk communication team. No, this has to be throughout at all times in order to offer significant, relevant, and accurate information to clarify and help the target audience understand what the situation is all about. Specific objectives of the strategy, okay. Basically seek the participation of all groups of interest, create the risk communication team, facilitate interinstitutional and coordinated implementation, that is at all levels. As I was just saying, both in times of peace as well as at times of disease. We need to define communication strategies for each phase, have a head or coordinator that can be activated during a given sanitary event and activate the team, but also in times of peace.
Fortalecer la credibilidad y confianza.
strengthens credibility and trust. This is fundamental in order to transfer and communicate appropriately and protect the health of population and support the export markets. This is not just for our consumers' health, public health, One Health, but also to be able to uh, uh, do away with tariff and non-tariff barriers in order to continue to export. Promote the adoption of good practices and healthy behavior related to food safety and animal health. And a fundamental component that also has to be taken into consideration is to evaluate each phase. The first phase, at the beginning and at the end, all phases have to be evaluated through indicators and goals, as we will see later on, to know whether this is really working. Establishing a risk communication strategy or a plan must have a structure that favors the four following steps or phases: review literature, create a database, develop information in order to disseminate it. The dissemination policy that must be intra and interinstitutional, disseminate the message considering all dissemination channels. And we must have continuous evaluation. More words. I'm sorry about this. But we will have an image in a moment. The General Risk Communication Team, which is a sort of commission, however you want to call it, is responsible for implementing all actions identified in the plan. It consists of technical staff from the sanitary surveillance communicators and all directorates that are appropriate, both locally, nationally, and regionally. In turn, to implement a plan, there must be a guidance document that contains operating policies. Policies are always necessary, and the legal framework is also important to support policy and have legal support. This document will allow to operate the program as part of the risk analysis, and this is where we explain the political channels regarding the decision-making of official messages. Okay, this is the one I was talking about right from the beginning. But anyway, this is the entire team, the commission. And there's a technical secretariat, a head of coordinator, however you want to call them, and interact with all those institutions that evidently cover the entire agri-food chain of international organization, ministries of the environment, agriculture, obviously, environment. As we know, consumers are fundamental in all of this. They have to be part of it and must remain permanently informed. We have to think of how to communicate this risk and how to manage this risk or concern. We must be at all times trying to handle this perception. So to ease the fear, we must be very careful to ensure the disease is not introduced into the countries. And now I come back to this previous slide. This is a complex and dynamic strategy, but must exist. Sometimes institutions cannot be coordinated appropriately, but this would be the ideal case. We need to have funds to create the institutional structure and someone to really coordinate and for the scheme to work. Evidently, many countries need to gradually adapt and incorporate gradually. We cannot hope that this can be done overnight, but it is way too complicated. Okay, but here, this is part of the preparedness and prevention in times of peace. The dissemination policy must be in writing. Why? Well, to improve the perception of the target audience and improve the communication strategies facilitate communication among institutions, strengthen the capacity of the team, and this is fundamental. Here we need to train the spokespersons. Spokespersons must be part of this communication team, yes or yes, they must be trained. And yes, they must be utilized by the ministers or senior authorities that who cannot convey this message appropriately, because there has to be a communicator that knows how to communicate these activities or events, and then not handle risk perception against. But anyway, this is an example of an activities. The action could be prevent the introduction of exotic diseases, African swine fever, one of them. Who would be responsible for the action? That is the second column. Here you have a list. Who is it addressed to, directed to, the different objectives, goals, indicators, and timelines by when a given action must take place. The document is on the CVP website, and we are at your service, of course, to respond any question you may have in this sense. And here, once again, we see the survey on risk perception, who is in charge of this, goals, indicators, dates, etc. During the control phase, the objective has to be very clear, help affected and interested communities to understand their own risk with greater clarity, provide information that responds to the question, how could this have happened? Has this ever happened before? How can we avoid, prevent it from happening again? Listen to comments, active listening. We have talked about what that should be in on the previous seminar. Highlight the actions that had good results and then repeat the good things. Maintain communication in two ways, two-way communication. And here, once again, is an example of the table of action in responding to an event. Messages have to be clear, developed or produced by a trained communicator. This must be joint work with all those involved. So you can continue reading this later. And this is the way to show how to finish this. These are here some conclusions. Generate better information to support decision-making regarding food safety. Not react, but instead begin to plan, develop a database with all the information. This leads to strengthen the options of risk managers, not necessarily the head of the veterinary service. Risk managers can be in other ministries, and they all must be part of this coordination. Help ensure that the stakeholders are informed about the risks and about the risk management measures. Strengthen the agreement and support the stakeholders regarding risk decisions. And this reduces conflicts. And boy, does it ever do that. If we have all the participants in the chain empowered, well, evidently that will reduce conflict. In the case of the workshop I was mentioning of the Animal Health Commission, together with the public sector in 2019, that risk communication workshop, the private sector was very happy, very grateful. They drew very important conclusions. They were grateful because they finally got what risk analysis was all about. They really did not understand why that was necessary and how to move forward with communication. Obviously, this leads to trust in risk analysis process, and we must adequately manage the risk perception of the different links in the food chain. This can be done as a team and with a lot of training. And in ending, I would like to thank you for your attention and for the possibility to have participated in this manner. I thank you for listening to my recording. This is the CVP website, the Secretariat's email address, and we can gladly help you with anything we can. There's a whole list of products that we have. Wonderful. This has been a lot of hard work this year. We continue to grow at CVP, and the publication you will have there on the website, and the Spanish and Portuguese version will be available too. So thank you very much. And I am at your service if you have any question or doubt.
Bueno, esta fue la presentación de
This
Gabriela.
has been Gabriela Campon's presentation from CDP, a great presentation. It's a continuation because this is linked with what we said during the past webinar on risk communication. And I would like to invite you, as of now, to keep on looking for those presentations and videos so that they can be disseminated among all the people that you think might read them in order to follow up on this series of webinars on risk communication. And not only when it comes to risk communication, but since last year, we have been bringing these webinars and seminars to you on different topics on the preparation for African swine fever. And we have also brought webinars on risk communication and also on the compensation mechanisms, legislation, and also risk analysis, among other topics. So we will constantly be fighting this African swine fever in America and the Caribbean. Now we will continue with our next presentation. Please send us all the questions that you need. I've seen many questions for Gabriela, and they will be sent to her by WhatsApp, and we'll be waiting for the answers for the Q&A session. And if that is not the case, please send us your contact information and email in order to be able to send you the answers on behalf of Gabriela and the CDP. And I would also like to remind you to please let us know where you are participating from, what is your institution. And we are going to leave you with a link on the CDP strategy on the chat. So please do not hesitate to visit this publication of the strategy. We will also try to include these links on our social media so that everyone can have access to it. And now to continue with our next presentation, on behalf of Shiloh Weir. She is a public affairs specialist with USDA APHIS, where she works on animal health issues, including African swine fever. We will also have with her for questions and comments Will Wepala, a specialist in public affairs with USDA APHIS, where he works on animal health issues, including African swine fever. So we will now continue with the preparation for risk communication on animal health in the United States. Shiloh, the floor is yours.
Thank you very much. I really appreciate this opportunity to share what the Department of Agriculture is doing with our risk communication efforts since African swine fever was detected in both Haiti and the Dominican Republic. Let me start by sharing my screen. The United States remains ASF free, but in 2021, as we know, ASF was detected in both Haiti and the Dominican Republic. And these were the closest detections to the United States in decades and pose an increased threat to the health of the US swine herd. Many safeguards, such as border controls, are in place to prevent the introduction, but ASF remains the #1 concern for the swine industry. USDA sees outreach and risk communication as playing key roles in preventing ASF from reaching the United States. And because of this, our efforts in public affairs are well supported and get a lot of visibility within our organization. As part of the overall USDA efforts, it was determined that awareness and education would play that key role in preventing ASF from reaching the United States mainland, Puerto Rico, and the US Virgin Islands. We divided our initial outreach efforts into two primary categories: prevention and detection. And this guided us in determining our primary audiences. We focus communication on international travelers and producers and veterinarians as two separate campaigns: the Pigs Don't Fly campaign and Protect Our Pigs. The Pigs Don't Fly campaign is focused on prevention by raising awareness among international travelers. International travel is seen as the most likely pathway for African swine fever to reach mainland United States, Puerto Rico, and the US Virgin Islands. Our messaging is focused on people that don't know about ASF. And the main objective is really to increase general awareness of the disease among this audience. The outreach in Pigs Don't Fly campaign has been distributed between physical signage and digital advertising. We place targeted print and digital ads in the 9 top US airports for international travel. We run digitally targeted social media ads in the top 26 international airports. We also have geo-targeted web and social media ads in Puerto Rico and the US Virgin Islands. Our digital ad campaign targets travelers in a lot of ways. Through digital browser and social media ads on podcasts, Spotify, YouTube, and social media. Audiences are also targeted on the web by their behavior, such as searching for international traveler. All of our ads are placed in 5 languages, including Spanish, English, Haitian French, and Mandarin. All of our outreach and advertising efforts aimed at travelers steer this group toward a custom webpage where they can get additional information about the impact of African swine fever and traveler restrictions. The Protect Our Pigs campaign focuses on outreach to producers and veterinarians. These groups are critical to detecting ASF early, stopping the spread, and safeguarding the US swine herd. These audiences are among the nation's first line of defense against ASF. The campaign aims at educating and mobilizing these stakeholders to ensure they understand the threat, how to spot and report ASF, and have biosecurity measures in place to react quickly. We understand that the industry is already doing a lot and that they are aware of the risk of ASF. Our campaign primarily aims to encourage their vigilance and steer this audience to free information and resources available through the USDA. Additionally, we make sure, a specific effort to communicate to smaller groups like hobbyists, exhibitors, and general veterinarians to make sure that we're reaching everyone in this community. The tactics used to reach this audience vary a bit more than those used with travelers, primarily because we know where to find them. In addition to advertising on social media and with digital web ads, we employ focused efforts tailored to these specific audience segments. For example, we've placed sponsored articles and full-page ads in magazines like Pork Business, the Farm Journal, and Successful Farming. We've sponsored events like the Minnesota State Fair, the National Junior Swine Association Western Conference, and the American Royal Livestock Show. We've also hosted educational webinars, much like this one, with key speakers from the Animal Plant and Health Inspection Service and the swine health team. And much like the Pigs Don't Fly campaign, Protect Our Pigs has a dedicated website where the various audience segments can get free information and resources. You can see across the top of the page, we have custom information for producers, veterinarians, and small farms and pig owners. From October of 2021 to present, APHIS has been executing an overlapping, robust, multi-channel outreach campaign focused on educating audiences traveling to and from Puerto Rico and the US Virgin Islands. This has been our longest running effort in the campaign. The outreach campaign kicked off with a media outreach tour in the US Virgin Islands and Puerto Rico. It included radio spots and live read ads, print ads in custom newspapers, geo-targeted social media ads, and we have provided our partners in the US Customs and Border Patrol with printable posters and information for display in clearance and pre-clearance areas. And as you can see, it was pretty robust. We've had more than 1,000 radio spots in each location, both the US Virgin Islands and Puerto Rico. Multiple press releases have been distributed in Spanish and English, and digital web ads included. And that was since the beginning of our campaign. Even though our efforts to prevent ASF from reaching the United States have been relatively successful, we are still planning for the future. We are in the background working on crisis communication, preparing in the event there is a detection. We have been developing crisis communication strategy, and all of the supporting materials will need to be ready in case ASF reaches the United States. And we're working through all the actions we will take for each of these audiences throughout the phases of an outbreak, from the first detection through recovery. And we're also working cooperatively with organizations in the United States, such as the National Pork Producers Council and the National Pork Board, to make sure that the industry is tied into our efforts. In addition, for planning through for the future, our efforts on the current campaign are scheduled to end on January 31st, but we're evaluating the results of the current campaign to determine the best way forward for the next year. And we plan to continue the efforts as long as necessary to hopefully keep ASF out of the United States. Thank you very much. We really appreciate this opportunity to share all of the efforts that the United States Department of Agriculture is taking on risk communication and hopefully preventing ASF from reaching the US, Puerto Rico, and the US Virgin Islands. Thank you.
Thank you, Shiloh, for your excellent presentation. It's really great to have, as an example, countries like the United States that are so well prepared. And hopefully this will be a model for the countries that are currently preparing and developing risk communication campaigns so that they can keep on going with this prevention. And we're going to leave the questions for the end of the webinar. And I would like to remind you that you can start sending your questions through our social media or on the chat. Please send your questions, and they will be replicated here. So again, thank you, Shiloh. And William, you will be helping us with the questions, but for now, we will continue. Please, again, let us know where you are visiting or joining us from on today's seminar. And I would like to remind you that these webinars have simultaneous interpretation in 4 languages. We have Spanish, English, French, and Portuguese. So you can join our social media on any of these 4 languages, and you can also be a part of this Zoom meeting and choose the language that you would like to listen to. And now we will continue with our next presentation. On behalf of Carla George, she will be speaking about the experience in risk communications on animal health. She is the director of the School of Veterinary Medicine of the Faculty of Medical Sciences of UWI, appointed back in 2018. She is the first female director of the school and the first graduate of the UWI SVM to be appointed in and this leadership role from the class of 1995. She holds a master's degree in veterinary epidemiology and herd health from Utrecht University, the Netherlands, and has a PhD in epidemiology from the UWI. Her research career focuses on tick-transmitted diseases, food safety, and traditional remedies for animal health, all under the umbrella of public health. She is the chair of the Carib Vet Vector and Vector-Borne Disease Working Group. And outside of the academia, she enjoys gardening, being outdoors, the company of good friends and family, and playing with her 4 dogs. So, again, thank you, Doctor, and please go ahead. The floor is yours.
Thank you very much, Erica, for that wonderful introduction. I am presenting on behalf of the Carib Vet Network, and they basically put together this presentation as a group, and a lot of it has to do with coordinating the communication efforts in the network during the various disasters that we've been experiencing over the years. So these are my co-authors: Patricia Bedford, Jennifer Pradell, Gavin Peters, Christopher Ora, Eric Etta, and Pastor, Janine, Paula, Victor, Dean, Sean, Yobini, everybody. So I just want to mention, I have it's a collaborative effort today. So just a little bit of reminder of the whole scenario. We had a number of steering committee meetings, and in 2020, there were recommendations to establish a communication and coordination mechanisms for the region and the group. And this was seen by CAFSA, which is the Caribbean Animal and Plant Health Agency, Agriculture and Health Agency, Food and Agricultural Health Agency, and CARICOM, which is the Caribbean Community Secretariat, to be some sort of, to be the overarching institution in the Caribbean. And the communications working group, we thought, would play a leading role in pulling activities together and to get support from CAFSA and CARICOM and the other member states. At the CVO meeting, which is Chief Veterinary Officer meeting on June the 4th, we also recognize the important and essential role that the network will play in strengthening communication for other factors, most notably for African swine fever emergency preparedness and any of those programs in the Caribbean. We also wanted to support Carib Vet support for the CVOs for Carib Vet to strengthen and formalize this shared communication and coordinating strategy mechanisms so that we can have a more effective and comprehensive and efficient outreach in the communication strategies. So the coordination committee and the working group thought of developing tools and mechanisms that can be applied for other areas, especially for African swine fever. And you know that there have been several disasters in the Caribbean, and most recently there was the volcanic eruption in St. Vincent, the Soufriere volcano eruption. And with this, the network was able to formulate a preparedness response to that disaster. And this is one of the things that I will be walking you through in this presentation. So the CaribVet network, it's a huge network with a lot of participation from several entities. You know, we have ICA FAO, WOAH, CAFSA, CARICOM, University of the West Indies, Ross University, Pan American Health Organization, CIRAD, St. George's University, etc. So we do have an USDA and SENSA in Cuba. So it's a complex network of partners within the Caribbean. And its members have been growing since its coordination facilitated in 2012. And in 2018, we formed a decision-making steering committee. And since 2021, there has been some growth in terms of managing the network. So just to give you an idea of how it evolved, so we sort of went through or going through these types of steps in terms of community participation, where we moved from consultation to just do some material incentives like for grants and small projects, where we have more, where it's becoming more functional with a lot of cooperation between members. And we are now also being very interactive, where we are actually learning quite a lot from each other. And now we have to try and move into that phase where we can really have formal self-mobilization and collective action. So we know that we need an enabling and efficient environment to work. And we do have a lot of mechanisms, and it's important also to develop some further improvements, perhaps through a tool for putting things together. So the priority application in communications has been disaster risk reduction and management. We know that there are several types of disasters, and right now our communication is very much evolving or strengthening when it comes to looking at natural disasters. And this is just one of the disasters that has taken place recently in the region. And the other, as we've spoken about from other speakers, we're looking at communication through the outbreaks in the region on African swine fever. Okay. So as a case study, I will just kind of give you an idea of the chronology of the events that took place when looking at our preparedness and our response to the volcanic eruption in St. Vincent. Okay, so there was an orange alert around December 2020, and the St. Vincent and the Grenadines Ministry of Health started to prepare for the volcanic eruption. And there was of course communication with the coordination committee, steering committee of CaribVet. And around February, there was more communication. And by March, we knew that there was increased volcanic activity. And the St. Vincent Ministry of Agriculture shared their priority needs with the CaribVet. By March 26, we had an emergency working group meeting, and there was file sharing of the documents, the needs documents, or the need items specified by SVG at St. Vincent and the Grenadines at the time. Then we started to communicate through creating a WhatsApp group. And then there were more efficient regional mechanisms defined. And we had lots of emergency meetings and meetings with other partners such as CAFSA, etc. And by April the 9th, we had the explosive eruptions of the volcano and many more emergency meetings taking place. So the volcanic eruption, the volcano response group via WhatsApp at this time started off with about 33 participants from 8 different countries representing around 20 organizations. And we created a Google document, as I said before, where we were able to itemize the needs and share how we will go about helping St. Vincent fulfill these needs. So as you can see, there are many steps involved. It's a very complicated process. And we need to share official communication, which is relevant to and updated with a large audience. And we had to agree on the mechanisms. And I just want to note that official coordination, the countries already have official mechanisms by which help or aid for disasters will go through. So we could not be independent or pillars working in isolation. We had to work in coordination with our groups or regional official entities on the ground. Okay, so that was made abundantly clear from the start, right? So even though we called ourselves a core group, we know that we were not working in isolation, that we had to communicate to the official channels, and the messages that we sent had to be originating from official channels. Okay, so the main groups were the core groups, and the persons who were affected, that will be the St. Vincent and Grenadines Ministry of Agriculture, and their CVO communicated directly to us. And then of course we had a disaster preparedness working group, etc. Okay, so we needed to ensure that we have active persons with the expertise and the interest. And through that, we also started to communicate with other groups, such as the Caribbean Disaster Management Agency and the Red Cross, etc. So we had to make sure that we formed synergies, or we kept involved with what other groups were doing in order for us to be efficient and effective, and not duplicate efforts or not provide too much duplication of efforts. Okay, so for the volcanic eruption, we had our needs expressed. We know who the affected country was. We made sure we did our Google Doc, and we updated our data entry sheets. We were able to validate items that were most needed, and we tried to share widely as much as possible with our partners. Okay, so we had to understand who is doing what and when, and communicate this through all partners. So we had the affected zone and the sub-region, they expressed their needs, so I'll just go through that again. And then we had to understand, how do we go about now fulfilling these needs of the country? Okay, and that is where a lot of a lot of the hiccups took. So we were able to, again, leverage on our network membership. So a lot of our networks were already part of other groups. At the same time, keep updating the needs and support. So we had to ensure that the updated needs and support were in tune with local coordination and logistics, and try to share those types of logistics with other groups. For instance, in order for us to get supplies from Trinidad and Tobago, we had to coordinate with the Ministry of National Security and our Office of Disaster Preparedness and Management. And Trinidad was able, not only Trinidad, but Trinidad as an example, our Ministry of National Security had a barge or a designated ship to send supplies to St. Vincent and the Grenadines, okay? And they were in coordination with the disaster preparedness group in St. Vincent and the Grenadines, the Port Authority, and all the other approvals that had to take place. So we had to ensure that our shipments, our donations of supplies, had the correct paperwork, etc., for shipping. And then when it reached the port, it had to be offloaded, landed, and distributed. So there's a lot of communication that had to go on between the steering committee and all these entities in order to be successful, so that the needs of the recipient country could be fulfilled in a fast and effective manner. Okay. So our working group coordination was able to use WhatsApp quite a lot in order to share those experiences and give timely updates to our other stakeholders and our donors, etc. Okay, so as you can see, it's not a simple operation. So anything is really a very complex operation, and you have to be understand the supply chain, basically the supply chain from start to end. So with that comes quite a lot of trust. So as the CARIVET working group, as you saw, its establishment around 2012 and building its collaboration and trust over the years, we were able to have a history of trust and collaboration, friendship and commitment, because it took a lot of those skills, that skill set, to be successful in a space where you require prompt action in a very and you have a very short window to help mitigate against any further disasters. We were able to get new people into the group, integrate them very easily, because most of them were sort of word of mouth recommendations. So we know that this person will be helpful. Let us get them on board. So those people have to be interesting, willing to assist, etc. Again, when you look at the community of practice, we knew what everybody in the group brought something in terms of roles and responsibilities from maybe their own job description, and some of it was already established. Okay, we tried our best not to have overlap and duplication within our own network itself, and of course with our partner networks and with any other governmental organization or any other response group. We tried our best to form synergies with other organizations, such as I said earlier, the Red Cross and other groups, non-governmental organizations who were interested in assisting with this response. Again, we capitalized on previous experiences that we've had especially through natural disasters in the region and coordinating efforts such as when we had Hurricane Irma, Hurricane and Maria. So the efforts our hope is to create a tool to have some work efficiency, but that is still under construction, so I won't really go into that. But what I must say, it's important to keep the core group together. CAFSA, FAO, CIRAD, all the working group chairs, all the other organizations and entities, University of the West Indies, CENSA, etc., to be able to maintain a coordinated effort, a coordinated trust. And we do have these things documented so that we know how to move, and we have that experience within the region, at least with the natural disaster efforts. Okay, so ultimately, this is something that we would like to develop, to have a tool, everything in one place. This is still under construction, as I said before, but this is where we would like to move forward with communication, so that it probably won't just be for one type of disaster, but something that can work to help coordinate different agencies and entities as we move forward. Okay, so this is just a little idea of what it may look like. And this ends my presentation. Thank you very much.
Thank you, Dr. Carla, for this excellent presentation. Thank you for sharing all this experience that you have had due to natural disasters and how you have prepared. This is an example for all other countries, because I know that all our countries have one way or another confronted natural disasters or cross-border diseases like avian influenza. So we can extrapolate all this risk communication strategy and prepare our own plan for African swine fever. I believe we all have the experience and a good part of the knowledge, and I am sure we can see these models that already exist. Excellent. I'm glad to see that in the Caribbean, the integration of all these institutions has been fundamental. The articulation among all those institutions, fabulous. So I invite you to continue sharing examples. Look within your own countries for further experiences. Thank you very much, Dr. Carla. And now let us continue with the question and answer session. I would like to highlight, though, before we go into that we have reports we have people from Oaxaca and Jalisco in Mexico, Michala in Venezuela, Maga in Guatemala, the Costa Rican Swine Growers Association in Costa Rica, Panama, the University of the Amazonia in Colombia, the Food and Agriculture Department of California, and MAG in El Salvador. So thank you very much for reporting your presence. It is so important to realize that we do have an audience not just focused within the ministries of agriculture or the official sectors, but also these seminars are being heard by the private sector too. So it is so important for all this knowledge reach the growers, producers, academia, research centers, etc. So we thank you. We invite you to share this initiative that we have been working on for over a year now, and that we will continue with throughout the next year. So with this now, let us move into questions. We already have several. We have been able to contact Dr. Campon. So we will read some of the Gabriela's questions or responses, I would like to invite the panelists to activate their cameras for this next section. I would like to thank everyone for your excellent presentations. This has truly helped us know the materials that already exist in our region. So we will hope to continue with this webinar next year with more experiences. Okay, so the first question reads as follows. This is for Gabriela Campon, and it says, in the interdisciplinary group for risk communication, have you considered the participation of the consumer defense interest representative or the person responsible for public education, for example? And Dr. Campon has responded as follows. The team could consist of all organizations the country decides should be part, and consumers are fundamental in all this process to develop this strategy. So that is her response to this question. Next question, also for her. What other audiences is risk communication aimed at, aside from travelers? And here is the response from Dr. Campon. Risk communication is aimed at everyone, all the way from the authorities, risk managers, ministries, consumers, travelers, etc., everyone. They see this as an integrated response in the sense of One Health also. And the last question for Dr. Campon is, at what age do you think that children, school children, should be receiving cross-border prevention education, particularly regarding animal diseases? And she says the agri-food chain should be permanently informed ever from times of peace until times of crisis, and includes the citizenship at large, children. Schools could be a very important means to start education in this sense. With this, they would be better prepared to address diseases that affect human beings, One Health, and caring for the environment at the same time. Oh, and there's a last one. I'm sorry, there's a last one for Dr. Campon. Let's see. Where is it? Oh, here it is. Okay. The campaigns we usually undertake regarding risk for cattle ranchers due to the presence of other animal diseases and that have not been subject to a formal risk analysis, could we call these risk communication activities? For example, when bovine brucellosis is very high in a region and we advise them to vaccinate and test, is that risk communication? Well, this is a very broad general question, and allow me to read Dr. Campon's response. But I would like that if any other panelists would like to add anything to this, please feel free to do so. I will repeat the question in case you have anything else to add to this response. Okay. Those campaigns that we usually carry out regarding risks for cattle raisers in the presence of other disease agents, animal disease agents, but have not been subject to formal risk analysis, could we call these risk communication activities? So if you have anything else to add, I invite you. But for the time being, Dr. Campon has responded as follows. She says, yes, Anyway, in risk communication, there must be a risk communication policy resulting from the sanitary policy and safety policy, interconnecting these at all times, connecting managers, evaluators, communicators. Otherwise, these would be loose ends that would not be effective or efficient. This is the response from Dr. Campon, but I wonder whether anyone else has anything else to add. Otherwise, we can continue with the next questions. Anything else to add? Go ahead and open your microphone. Otherwise, on we go. Okay, the next question now is for Dr. Shiloh. And of course, William, in your campaigns, do you include field workers that go to the United States, for example, from the different countries from the Americas and Africa or Europe? Because many of them do not necessarily cross borders formally. So how do you share this information at the workplaces where they are? That would be the question.
I can take this. Part of the education and the information that we're providing to like the farm owners is information available in English and multiple languages, so they can post information up at their work sites so that they can train their workers, no matter what the source of their workers is, on biosecurity and those sorts of things, to make sure everyone that enters the farm, no matter what the source, has the same information as the people that may own the facility.
Thank you, Shiloh. Will, would you like to add anything?
No, I think Shiloh got it. Yeah, basically we have resources as part of the outreach campaign, and those resources are meant for producers, farmers to be able to print them and post them at sites. We also did produce a certain number of posters and then other information that can be posted at farm sites in different languages. So that's cool. That's how we're hoping to communicate those things with those audiences.
Muchas gracias, William.
Thank you, Will. Well, let us continue with the next question for Dr. George. Do you have a manual to apply a communication mechanism or an articulation mechanism? Do you have a manual?
Okay, at this time we are developing a manual. Actually, we are part of a disaster risk reduction initiative, and we are putting together a consultant and a project coordinator. And one of the terms of reference of the consultancy is to develop a manual for the network. So we have the pieces in different spaces. However, we haven't put it together in one document. And just to understand, any document has to be able to be easily altered and reviewed, etc. But yes, so by next year, we will, I would say by March or so, if everything goes according to plan, we'll have a manual available.
Thank you, Dr. George. Another question for you. Could you elaborate on the relevance of that core group and the role of each participant in it? Is that in an organizational chart or in any document? And how do you articulate the participation with the private sector?
Okay, so the steering committee of Carib Vets is actually part and parcel of the network's bylaws. So we have a steering committee, and the members of the steering committee are elected annually at the Carib Vets, and we have an annual meeting. Okay, So yes, so there are bylaws of CARIVET. You can get it on the CARIVET Network website. And for how do we communicate with our other groups? I'm sorry, just give me what's the second part of it? The second part of the
Yes, ma'am.
question. Okay.
Yes, ma'am.
Right. So everyone in the network is related somehow at this time to either a university or a ministry of agriculture or anything to do with agriculture within, or the appropriate ministry of agriculture, either that or organization within their own country or region. So we have members like from in our group who are PAHO. We have members in our group who are USDA. We have members who are from APHIS. We have members from different organizations. Okay. And the most important is that we have members who are government employees of the core country that we are. And plus we have people from private sector. So with all of these links, because of all of these already established links that are there, we have a line of communication. Okay, so our established line of communication would be to the governmental agencies, would be either through the chief veterinary officer or equivalent in the member states, or the head of each of the governmental or the regional agencies. So, for instance, for CAFSA, which is the Caribbean Agriculture and Health and Food Safety Agency, the CEO of CAFSA is a member of the CARIVET Steering Committee. Okay, and so these members then have access to their relevant lines of communication or boards. Okay, so for instance, the Caribbean Emergency and Disaster Management Agency communicates with CAFSA. So a member from CARIVET wouldn't directly communicate with them. We will communicate through the relevant agency or the relevant reporting line for that particular current country. So as I said, it's a complicated network, but the synergies have been established through trust, friendship, and all of that. Okay, and so that's what makes it work. And then the people who are coming are actually recommended by, if somebody has to leave, they will recommend somebody who has to be willing and all of that to take on the responsibility. Yeah. So I don't know if it's a long answer to a short question. Okay. Yeah.
No, thank you very much, Dr. George. Excellent. The better the explanation, the better for everyone. The longer it is, the better. Okay, we have a question here. I am focused on the border between the Republic of Venezuela. I work at the Colombian Agricultural Institute, and I have to pose a question. In Venezuela, are there African swine fever programs? Do you know that? We have a lot, it's a long border. Among the panelists, we have no representative from Venezuela, unfortunately, although we have the Venezuelan office represented here among the participants. But thinking of the overall preparedness for all Latin America and the Caribbean, we are undertaking a series of initiatives precisely for this purpose. That is the objective of training courses like this. It is very important that both at the level of Venezuela as well as other countries, everybody is trained on how to better be prepared to prevent African swine fever. This is an initiative that is interagency, multi-agency. We are working in favor of training to prevent African swine fever. all international and regional agencies, as we said earlier, so that we can reach all audiences, not just the official level. No, we want to go all the way down. The private sector, the producers, academia, research institutes, consumers. These seminars are open for everyone. So please, in fact, I invite you to disseminate these materials. These materials have been recorded and they are very, very important. We bring examples not only of what is being done or how we are responding to African or preparing to respond to African swine fever in the Americas, but we also have brought experts from outside countries that have already experienced African swine fever. So take advantage of this. This is one of the best ways to prepare everyone. Okay, the last question for Shiloh and William. The question is, how do you go about evaluating the impact of the risk communication actions among the different stakeholders? And how do you address the change in behavior thanks to communication? I guess those are the two questions for you. Go ahead.
Yeah, I can jump in. I think that, especially for the digital communication, we can track how many people are seeing the advertisements, whether it's compelling them to click on the link and find more information. So that's the biggest thing. And then another thing that we're trying to do, so that's just for general information. And then one thing that we want to encourage veterinarians to do is to, if they have a suspicious case, to report it to federal or state authorities, to have them come and see if it is a something of concern, because we know that African swine fever can look like other diseases that affect pigs. So I think that as we go forward, seeing if we're having more action by veterinarians and producers to follow up on those calls to action, to actually invite them, will be a good way to see how much success we're having.
Thank you very much, William. I wonder whether Dr. Shiloh would like to add anything.
I think we'll cover it. Thank you.
Okay, excelente. Bueno.
Excellent. Well, thank you all our panelists. So thank you so very much, Dr. George, Shiloh, William, Gabriela Campon, who is here but not here. But she has been keeping an eye on us, an ear on us. She has been responding to questions via WhatsApp. I would like to thank all the international and regional agencies that are always paying attention to all our work, helping through these seminars, helping ICA. And particularly, I would like to thank all the participants that have been with us throughout these webinars so far. It is very important for us, for you to share this invitation, share it with everyone, invite people to participate more and more in such a valuable training event as this. This is macro training. We have been going through preparation in order, I guess, that will lead us to a good response to the African swine fever outbreak. And in times of peace for all countries, this is obviously of great interest for the Dominican Republic and Haiti. So thank you all very much. This is the last webinar of the year, but not the last in all this series we are undertaking. We still have 1 year ahead of us. The third webinar regarding risk communication of this series will be held February 28th. Write that down. Write that down. We invite you. Everyone is invited to continue with us. Thank you, Shiloh, William, and Carla. We will be bothering you again in the future. Happy holidays, and I hope to see you next year. Thank you. Thank you all. Big hug
Thank
to
you,
everyone.
everyone.
Thank you.
Thank you.
Thanks again.